91999399068 World Safe Low Cost Cancer Treatment. As a doctor, in my 33 years medical practice, I have seen how million people are dying in modern allopath medicine. In my blog I am doing awareness so that people may live long life. For example, chemoradiation treatment always kill the cancer patient with much pain. It is universal truth. You can search on internet. In my lifetime I never saw people cured by chemo and radiation. Still, after my awareness, people choosing death means chemotherapy, then God will not do anything for them because chemo and other modern medicine are poison, and by using you are doing suicide. I am treating cancer, AIDS, diabetic, heart/kidney failure, leukoderma vitiligo, tumor, menstrual problems, obesity, all mental illness, lack of vitality, heart attack, stone, infertility, paralysis, asthma and all 2000 diseases. I use only herbal Ayurveda and homeopath. All this medicine are safe, no side effects, and has power to root out any diseases permanently. According World Health Organization, 60% herbal medicines are being used in all modern medicine, but they are not effective because they mixed with chemical medicine, which is full of side effect. If your doctor failed to treat you or you have been to many doctors, then don't allow your doctor to research on your body because you are precious. Come for our scientific herbal permanent treatment. It is low-cost treatment in the world, means no fees, almost free treatment. Call 919,993,906,875, 919,109,714,270. For online treatment, send your details to drordas8@gmail.com, www.freecancerfree.com. Many cancers can be prevented by not smoking, maintaining a healthy weight, not drinking too much alcohol, eating plenty of vegetables, fruits and whole grains, vaccination against certain infectious diseases, not eating too much processed and red meat, and avoiding too much sunlight exposure. 14-15. Early detection through screening is useful for cervical and colorectal cancer. 16. The benefits of screening in breast cancer are controversial. 16-17. Cancer is often treated with some combination of radiation therapy, surgery, chemotherapy and targeted therapy. 2-4. Pain and symptom management are an important part of care. 2. Palliative care is particularly important in people with advanced disease. 2. The chance of survival depends on the type of cancer and extent of disease at the start of treatment. 11. In children under 15 at diagnosis, the 5-year survival rate in the developed world is on average 80%. 18. For cancer in the United States, the average 5-year survival rate is 66%. 5. In 2015, about 90.5 million people had cancer. 6. About 14.1 million new cases occur a year, not including skin cancer other than melanoma. 11. It caused about 8.8 million deaths, 15.7% of deaths. 7. The most common types of cancer in males are lung cancer, prostate cancer, colorectal cancer and stomach cancer. 19. In females, the most common types are breast cancer, colorectal cancer, lung cancer and cervical cancer. 11. If skin cancer other than melanoma were included in total new cancer cases each year, it would account for around 40% of cases. 2021. In children, acute lymphoblastic leukemia and brain tumors are most common, except in Africa where non-Hodgkin lymphoma occurs more often. 18. In 2012, about 165,000 children under 15 years of age were diagnosed with cancer. 19. The risk of cancer increases significantly with age, and many cancers occur more commonly in developed countries. 11. Rates are increasing as more people live to an old age and as lifestyle changes occur in the developing world. 22. The financial costs of cancer were estimated at $1.16 trillion USD per year as of 2010. 23.
Cancer is a group of diseases that involve abnormal increases in the number of cells, with the potential to invade or spread to other parts of the body. 1. Not all tumors or lumps are cancerous. Benign tumors are not classified as being cancer because they do not spread to other parts of the body. 1. There are over 100 different known cancers that affect humans. 1. Cancers are often described by the body part that they originated in. However, some body parts contain multiple types of tissue, so for greater precision, cancers are additionally classified by the type of cell that the tumor cells originated from. These types include carcinoma, cancers derived from epithelial cells. This group includes many of the most common cancers, particularly in older adults. Nearly all cancers developing in the breast, prostate, lung, pancreas, and colon are carcinomas. Sarcoma, cancers arising from connective tissue, that is bone, cartilage, fat, nerve, each of which develop from cells originating in mesenchymal cells outside the bone marrow. Lymphoma and leukemia. These two classes of cancer arise from cells that make blood. Leukemia is the most common type of cancer in children, accounting for about 30%. However, far more adults develop lymphoma and leukemia. Germ cell tumor, cancers derived from pluripotent cells, most often presenting in the testicle or the ovary, seminoma and dysgerminoma, respectively. Blastoma, cancers derived from immature precursor cells or embryonic tissue. Blastomas are more common in children than in older adults. Cancers are usually named using carcinoma, sarcoma or blastoma as a suffix, with the Latin or Greek word for the organ or tissue of origin as the root. For example, cancers of the liver parenchyma arising from malignant epithelial cells is called hepatocarcinoma, while a malignancy arising from primitive liver precursor cells is called a hepatoblastoma, and a cancer arising from fat cells is called a liposarcoma. For some common cancers, the English organ name is used. For example, the most common type of breast cancer is called ductal carcinoma of the breast. Here, the adjective ductal refers to the appearance of the cancer under the microscope, which suggests that it has originated in the milk ducts. Citation needed. Benign tumors, which are not cancers, are usually named using -oma as a suffix with the organ name as the root. For example, a benign tumor of smooth muscle cells is called a lymphoma. The common name of this frequently occurring benign tumor in the uterus is fibroid. Confusingly, some types of cancer use the -noma suffix. Examples including melanoma and seminoma. 3-4. Some types of cancer are named for the size and shape of the cells under a microscope, such as giant cell carcinoma, spindle cell carcinoma, and small cell carcinoma. Citation needed. Contents: 1 bone and muscle sarcoma, 2 brain and nervous system, 3 breast, 4 endocrine system, 5 eye, 6 gastrointestinal, 7 genitourinary and gynecologic, 8 head and neck, 9 hematopoietic, 10 skin, 11 thoracic and respiratory, 12 HIV/AIDS related, 13 unsorted, so far, 14 see also, 15 references, 16 external links. Bone and muscle sarcoma, chondrosarcoma, Ewing's sarcoma, malignant fibrous histiocytoma of bone, osteosarcoma, osteosarcoma, rhabdomyosarcoma, heart cancer, brain and nervous system, astrocytoma, brainstem glioma, pilocytic astrocytoma, ependymoma, primitive neuroectodermal tumor, cerebellar astrocytoma, cerebral astrocytoma, glioma, megaloblastoma, neuroblastoma, oligodendroglioma, pineal astrocytoma, pituitary adenoma, visual pathway and hypothalamic glioma, breast cancer, invasive lobular carcinoma, tubular carcinoma, invasive cribriform carcinoma, medullary carcinoma, male breast cancer, phyllodes tumor, inflammatory breast cancer, endocrine system, adrenocortical carcinoma, islet cell carcinoma, endocrine pancreas, multiple endocrine neoplasia syndrome, parathyroid cancer, pheochromocytoma, thyroid cancer, Merkel cell carcinoma, eye, uveal melanoma, retinoblastoma, gastrointestinal, anal cancer, appendix cancer, cholangiocarcinoma, carcinoid tumor, gastrointestinal, colon cancer, extrahepatic bile duct cancer, gallbladder cancer, gastric, stomach, cancer, gastrointestinal carcinoid tumor, gastrointestinal stromal tumor, GIST, hepatocellular cancer, pancreatic cancer, islet cell, rectal cancer, genitourinary and gynecologic, bladder cancer, cervical cancer, endometrial cancer, extragonadal germ cell tumor, ovarian cancer, ovarian epithelial cancer, surface epithelial stromal tumor, ovarian germ cell tumor, penile cancer, renal cell carcinoma, renal pelvis and ureter, transitional cell cancer, prostate cancer, testicular cancer, gestational trophoblastic tumor, ureter and renal pelvis, transitional cell cancer, urethral cancer, uterine sarcoma, vaginal cancer, vulvar cancer, Wilms tumor, head and neck, esophageal cancer, head and neck cancer, nasopharyngeal carcinoma, oral cancer, opharyngeal cancer, paranasal sinus and nasal cavity cancer, pharyngeal cancer, salivary gland cancer, hypopharyngeal cancer, hematopoietic, acute biphenotypic leukemia, acute eosinophilic leukemia, acute lymphoblastic leukemia, acute myeloid leukemia, acute myeloid dendritic cell leukemia, AIDS-related lymphoma, anaplastic large cell lymphoma, angioimmunoblastic T-cell lymphoma, B-cell prolymphocytic leukemia, Burkitt's lymphoma, chronic lymphocytic leukemia, chronic myelogenous leukemia, cutaneous T-cell lymphoma, diffuse large B-cell lymphoma, follicular lymphoma, hairy cell leukemia, hepatosplenic T-cell lymphoma, Hodgkin's lymphoma, hairy cell leukemia, intravascular large B-cell lymphoma, large granular lymphocytic leukemia, lymphoplasmacytic lymphoma, lymphomatoid granulomatosis, mantle cell lymphoma, marginal zone B-cell lymphoma, mast cell leukemia, mediastinal large B-cell lymphoma, multiple myeloma, plasma cell neoplasm, myelodysplastic syndromes, mucosa-associated lymphoid tissue lymphoma, mycosis fungoides, nodal marginal zone B-cell lymphoma, non-Hodgkin lymphoma, precursor B lymphoblastic